everyone, Dr. Virginia Ellis over here. So right now what I'm going to do in this video is discuss the oral health and systemic health link, meaning the state of the health in your mouth connected to the state of the overall health in your rest of your body. So how does oral health affect heart health? Yes, oral health and heart disease, gum disease, and heart health are related, just as oral health affecting the overall health of your body. So when you have bacteria in your mouth and in your gums that is out of control, here's the thing: when there's an imbalance or an overgrowth of bacteria in the form of cavities or in the form of gum disease, bacteria that causes gum disease, it does spread into the rest of your body through blood circulation. And what it can do is it can cause heart problems, because that bacteria can travel through your blood system and reach your heart, especially for people who have compromised or weak valves. That can predispose you for an infection in your valves called endocarditis. That's a really nasty thing to have, okay? And also your overall health. If you have artificial knees or hips, shoulders, if you are weak, you can be predisposed to having infections in those joints, especially if they are less than 2 years old. The other thing that is important is you can get something called sepsis, which is basically infected blood, pussy blood, okay? A lot of pus flowing through your blood and all of your body. I just had a patient who had that situation. I was called from the hospital. The sons were coming in here trying to get him in. He didn't take care of his health, but he finally did after that fiasco. You don't want to do that. It could really compromise your life, put you at risk of dying. That's a really serious thing to happen, okay? The other thing is, can oral health impact diabetes management? So oral health and diabetes and gum health, managing diabetes with oral care are very, very important. So it is a common fact that if you have an unbalanced growth of bacteria or swollen gums, uncontrolled gum disease in your mouth, it directly worsens your diabetes. And the same thing is true with diabetes. If you have uncontrolled diabetes, it's going to affect uncontrolled health status in your gums. It also puts you at risk of losing teeth, okay? So they each exacerbate each other. So if you have bad gums, you're going to have bad diabetes. Bad diabetes will, give you worse gums, bad gums. Why is dental care important during pregnancy? That's another health thing to consider. And by the way, I have another pregnancy video with post-baby birth instructions and pre-baby birth instructions that you should look at. Very interesting and useful information. Okay, so pregnancy and dental health, oral care during pregnancy, and gum disease risks in pregnancy are very, very real. There is documented research that if you do not have healthy gums, the baby is at risk of being aborted. There have been some cases, and it does happen because the bacteria in the mouth reaches the baby and it can attack the baby or create complications with immunity, okay? If you get pregnant, very, very important for you to floss and brush all the time and have your teeth cleaned once every 3 months, not once every 6 months, even if you happen to have healthy gums, because hormones of pregnancy inflame the gums much easier, okay? Is there a link between oral health and cancer risk? Yes, there is. Oral health and cancer, gum disease and cancer link, and dental checkups for cancer prevention are very, very important. There are documented statistics out there showing that there is a high risk for pancreatic cancer, liver cancer, and other forms of cancer linked to bad gums, because you create toxins and inflammation in other parts of the body. Remember, your mouth is connected to your body. The blood flows everywhere, and it flows into your heart, your liver, your lungs, your kidneys, everywhere, okay? So to decrease the chances of unnecessarily having inflammation and toxicity building up in your organs, it is definitely very important for you to stay updated with your recalls and your cleanings. dental cleanings. Can poor oral health affect immune system? Absolutely it can. So oral health and immune system, impact of oral infections and immunity, and boosting immunity with oral care have been documented. So if you have uncontrolled gum disease, inflammation, it will worsen your diabetes. It can worsen your the infection in your blood. That's what I talked about, sepsis. If you're very delicate, if you're a person coming off of cancer, if you are an organ transplant person, and transplant, medicines that lower your immunity, you have to be super careful to make sure that you have really healthy gums. Okay, so a delicate heart, you have to have really good gums so that you do not create unnecessary infections in your heart. And there's also documented research that some of the bacteria that is actually in your mouth can go up to your brain. Okay, linked research that has been shown to increase dementia with people having bad gums. Okay, so let's go ahead, make your appointments, stay updated with your checkups and cleanings, and that will help you out enormously. Also, the other thing we do look for is oral cancer in the mouth, super important, and also oral cancer in your head and neck. A lot of times, sometimes unfortunately I do find some oral cancer, and you don't want to have oral cancer in your mouth. If you do, you want to have it detected early, because when the stuff needs to come out, it's part of your tongue, your jaw, and it's also really close to your lymph nodes. If you have cancer and it's detected early in the mouth, it doesn't spread as quickly or as easily from the lymph nodes. Okay, so that you want to do. And also many times I do detect or catch cancer in the skin of the head, the ears, the neck, even in people who see the dermatologist. It takes a village. Sometimes one person sees something that the other person doesn't see, or sometimes something develops in between the 6 months or 1 year visits that people go to see the dermatologist for their checkups. All right, put a like in the video if you liked it, and sign up, click the subscribe button to get more interesting, useful, and helpful videos. I will see you at your next video. Bye bye.